The war on psychedelics did a lot to create an image that psychedelics are going to make you go crazy, which is entirely not true. Psychedelics work directly on the brain, which is really interesting from a pharmaceutical point of view. That makes it quite more interesting than just a party drug. There's this really intense link between the major female hormone and our major happiness receptor, which is so fascinating. Psychedelics are really interesting for women's health because if psychedelics are very good for mental health, there could be a gateway in to treating specific women's depression and trauma. Maybe there are women's health issues that are rooted in some of that trauma.
Welcome to Mother Podcast. In this episode, I sit down with Nina Patrick. She has a PhD in pharmaceutical science and is head of innovation at the Champalimaud Center of the Unknown in Lisbon, which is a state-of-the-art research facility where scientists are working on some really cutting-edge tech in oncology and neuroscience. Nina is also a writer, and she publishes Nina's Notes, which is a newsletter breaking down topics like longevity, psychedelics, Web3, space travel, and the future of medicine. So going back to the basics, what is a psychedelic, and what are some examples and some characteristics of a psychedelic substance?
Yeah, absolutely. I can kick us off just with, psychedelics in general. Psychedelics are psychoactive substances. They alter our perception, our mood, our cognitive processes. And the classic psychedelics, which is usually what people think about when they think about psychedelics, are Psylocibin, so that's the hallucinogenic compound in magic mushrooms, MDMA, which is ecstasy, and LSD, so acid. And they work all by activating the serotonin receptors in the brain, and that's what puts them in this family of classic psychedelics. And serotonin is best known as like the happy molecule. It contributes to our well-being and our mood and just generally our happiness. Then there's also psychedelics that fall into this non-classical psychedelic category, and this is ketamine, even THC, so the psychoactive compound in cannabis. And these work as activating receptors in the brain that are just not serotonin as the main receptor that they affect. They affect other ones. So those are basically the main two categories.
And probably important to address now head on the fact that for a lot of people, psychedelic drugs are, viewed as party drugs. So can you talk a little bit about what makes psychedelics interesting beyond that? What makes them interesting for therapeutic purposes, for human health and human well-being that extends beyond having a good time at a party?
Psychedelics work directly on the brain, which is really interesting pharmaceutical point of view, because the brain is difficult to get drugs into because we have the blood-brain barrier, which is a barrier that protects our brain from things coming into it. And since psychedelics mimic serotonin, which is a naturally occurring neurotransmitter, something that's naturally occurring in our brain, it's able to cross that blood-brain barrier. And because it can do that, it can inhibit and activate different receptors in our brain. And this makes it really interesting for health, especially for mental health and conditions like depression, anxiety, post-traumatic stress disorder, substance abuse, because we can actually get something into the brain to perhaps have an intervention. And that makes it quite more interesting than just a party drug, because it really is changing the biochemistry. And in some of those disorders, perhaps that biochemistry is at an imbalance, and we can push it into a rebalance by targeting it with these molecules.
Super interesting. And what would be an example of a psychedelic treatment and how it's done? I think in one of your newsletter articles, you talk about a ketamine clinic. How does that work? Do you just show up and take ketamine, or is there something more to it?
Yeah, great question. So as we know, psychedelics are illegal in most countries around the world. And the psychedelics that are in clinical trials right now are in clinical trials with another part, which is like assisted psychotherapy. So a lot of these interventions are basically psychedelic assisted therapy. MDMA is one of the first ones that will likely be legalized by the FDA for psychedelic assisted therapy next year. But ketamine is an interesting one because ketamine is FDA approved. And it's FDA approved at high doses as an anesthetic. So this is the drug that can be used to put you asleep during surgery. But as a psychedelic intervention, it's used at a sub-anesthetic level. And it's not FDA approved for this purpose, but it can be used off-label. A lot of drugs get approved and then they're used for other things off-label under a doctor's guidance. And because of this kind of gray zone in legality, there's a lot of ketamine clinics that are popping up basically all over the world. In the United States, I know in the Netherlands and in Europe, I know we have some coming in Portugal as well. And this is creating a very boutique experience to have a ketamine treatment. And so these ketamine clinics will usually have a anesthesiologist or maybe like a psychiatrist that can administer the ketamine because they do it intravenously. So it'll be an injection of ketamine, and then likely a nurse, and then somebody that's going to do the psychedelic assisted therapy with you. And the price point on this is quite high, I would have to admit. So I know in the United States, some of these treatments, it's like $800 a session. And yeah, so not exactly the most affordable for the general public at this time. And so I think the business model around this is probably going to have to change if they want to have it as mass adoption. But you'll start off basically by coming to the clinic because it's at least in the United States, it would be like a private payer situation. So you can just arrive and go through a screening. And if you qualify for treatment, because I'm sure there's a long list of things that may make you ineligible if you have health issues, or maybe if you're on other drugs to treat your depression or however you're feeling. And then if you qualify, they'll give you this infusion of ketamine and lead you through basically like a guided meditation or some type of therapy session. And then afterwards, you'll have another meeting with a therapist where you'll discuss the experience and perhaps even offer some integration there, because the integration concept is really important as you have this very intense experience. And we don't just want to drop you. It's very good to make sure that you kind of process that properly. How do you bring that into your life? What came up for you? And so with ketamine in particular, it's interesting because it's a short-lived drug. So it's not like LSD. Acid is a long experience, 6 to 8 hours. Mushrooms, you have 2 to 4 hours. Same with ecstasy, around 2 hours. But ketamine is quite short, 60 to 90 minutes. And you can have a very strong experience. I've never tried intravenous ketamine, but I imagine that it would be quite strong. And this can really leave like you coming out of that with a very positive effect and positive experience.
Yeah, very interesting. And I guess let's just address the legality aspect of it. As you rightfully so mentioned, psychedelics are not legal. So what is the current state of psychedelics being legalized, and who is leading that race, quote unquote, at the moment globally?
So this is it's a complicated one because it's changing, and it's changing fast in a lot of different regions. And one of the reasons I actually liked writing about psychedelics in the beginning was that it's not just interesting from a scientific perspective, but it's also really interesting from a policy perspective. And so I think the United States is definitely one of the leaders in getting these drugs into a medically approved direction. In terms of recreation, this is like on a different side. So we know that we have recreational psychedelics that are legal, that are also popping up in different places like the Netherlands, but more medical uses are also being legalized. So I know Australia just had a policy change in the summer that they enacted very quickly. They passed the law, and then I think quite immediately they were starting to offer, I believe, MDMA and maybe even as assisted therapies. And then the biggest study would be the MAP study with MDMA and psychedelic assisted therapy that's been in the works for the past 20 years. And they're coming to the conclusion of their phase 3 clinical trial and submitting to the FDA this year, and they should have the news next year. Followed shortly, they'll be followed by Psylocibin assisted therapy. And otherwise, it's then in the United States changing state by state, city by city. It's actually very hard to keep up with it because as soon as you get the medical legalization in the right direction, Colorado just had an election where they passed a law that they are going to legalize naturally occurring psychedelics, because how can you make a mushroom illegal? And I think that's a very interesting perspective. So there's also some psychedelics that are naturally occurring. So we have psilocybin in magic mushrooms, mescaline, which is in a cactus, same with peyote, and DMT. And so they're allowing these naturally occurring substances and psychedelic therapy with those substances. And then this has popped up as a gray space for now, like mushroom distribution. They also say that an individual can grow their own mushrooms legally and enough for their friends. But as long as it's not being sold, it's in a legal state. And so there's a lot of very interesting ways that these policies are being tackled. But generally, I would say it's safe to think if you're in a place, it most likely has some illegality to it. And If it is decriminalized, that doesn't mean it is legal. It just means that you're not going to face as much legal ramification because it puts too much pressure on the legal system. So there's some very unique ways that things are coming along. But yeah, I think in general, there's not too many places where it is legal.
Okay, maybe this is a really obvious thing to say, but I'm just going to say it again. So it's two different conversations. So one is to talk about psychedelics being legal to use recreationally. Like, for example, in Amsterdam, I can just walk into a shop and buy truffle mushrooms in a package, completely legal to use recreationally at home or at a party. That's one conversation. But it's a different conversation to be concluding whether or not psychedelics could make some kind of therapeutic difference for our health and well-being. And that's a different, legal conversation. And that requires data, clinical trials, evidence, publications. And it's a completely different conversation, both ethically and legally. So just to follow up then on what you said, in terms of clinical trials and evidence, what is currently being done to demonstrate the psychedelics can be a great thing as therapy? And what are we seeing in those trials?
Yeah. Okay, so kind of two things in there because you did talk about the legality. If you don't mind, I'm going to jump back to that quite quickly because I think it is very important to differentiate between recreational legality and then medical use legality. And so the strategy that is happening in the United States is basically that the psychedelic therapies are following the blueprint that was laid by medical marijuana and recreational marijuana. If we could think about it, that timeline that took, and then the rapid adoption of recreational, this is something that the psychedelics path is also simultaneously going down. So we have MDMA blazing the trail, followed by Psylocibin, and we already see, because Psylocibin is a bit unique because it's in a naturally occurring substance, that maybe there can be a quicker path to some recreational. But that's basically the blueprint because it's, hey, they've done this before with the FDA. They know how it's done. Let's give it a try with some of these other substances. And so with MAPS, they have a study for MDMA-assisted therapy for the use in post-traumatic stress disorder. And what they've shown is that with MDMA, with really like a single dose of MDMA, that they significantly can change how somebody is experiencing their PTSD. So really that like somebody that is, it's really a survey, they fill out the survey, they have extreme PTSD symptoms and experiences. And then after their 1, 2, or 3 interventions with MDMA, they basically more or less don't have PTSD anymore. So it's really incredible. So it's a very effective therapy and something that could be used maybe once or twice a year in a therapeutic setting and maintained in this capacity. And so doing that versus having a pill that you take every day is really much better for the patient. And so it's really incredible what they're showing. And I'm really it's really incredible that MAPS has been able to do this for so long. They've been privately funded. They had to fight for the last 20 years for the belief that these psychedelics had a use in mental health. And they had to fight through a lot of basically just like legal obstacles that were put in front of them this whole time. So really excited that's going to be hopefully getting the approval next year.
So you mentioned MAPS is blazing the trail on MDMA research. Who's behind MAPS? And who else is looking into doing this kind of research in psychedelic therapy?
So MAPS is its own research institute, but other research institutes, so we have academic research institutes that are doing work, then private foundations like MAPS, which is it stands for the Multidisciplinary Association for Psychedelic Health. Also, there's like the Beckley Foundation. They're also basically funded by donation. And these two foundations have been doing psychedelic work, for 20 plus years. And then, on the academic side, two most notable institutes would be Johns Hopkins University. They have a Center for Psychedelic and Consciousness Research, and then Imperial College London. There are quite a few more. So it's really quite exciting to me because when I did my PhD, and it was almost impossible to get any funding or even anyone to take you seriously that you were doing a psychedelic study. And now these universities are creating entire branches of their university dedicated to psychedelic research is really just mind-blowing.
And it's just really encouraging to see, and very indicative that if you see such established organizations like Johns Hopkins dedicating branches to research psychedelic therapy, it's really a sign that the space is growing and there's just less and less stigma around it.
I think people recognize it that we're doing some really solid science. There's really interesting a human study component to it. But it is still a bit taboo, honestly. Even in groups where I've spoken to just a small group that's like interested on psychedelics, and I ask people how many people have had a psychedelic experience, like only a fourth of the people in the group may raise their hand. So there's a curiosity, but there's still a reluctance. The war on psychedelics did a lot to create an image that psychedelics are going to make you go crazy, and which is entirely not true. And so there's a lot of work to be done in that like education portion, because these things are going to become legal in some capacity. And the more education we have about it, the better, because it may be something that people want to try in the future. They may have children that are encountering this more in maybe a recreational way in the future. Doing my best to help people understand how it works, why it works that way, and to have a little bit less fear about it.
What's the difference between using psychedelics and using antidepressants, for example?
Yeah, so the way that psychedelics work and then how that's different than antidepressants depends on the psychedelic, of course. But so I mentioned that psychedelics bind the serotonin receptor. And the way that they like elicit their effects on the body is either they activate that receptor or they inhibit that receptor. And so in the activation of that receptor, with MDMA in particular, you get this flood of serotonin. So you're flooding all the serotonin into the synapses, so the gaps in between your neurons, where the serotonin can have a lot of activity. And so this is why you're happy, you're elated. But at the end of an MDMA experience, there's this come down, you feel very blue. Your mood is very down because you're very depleted of serotonin. So you flooded all these synapses with serotonin, but the serotonin didn't come back up into the cell. And instead, it was taken to the trash or some other use in the body, but it is not going back into those neurons. So now you have to make more of it. So you have to have this like replenish period. So you feel quite blue. However, LSD and psilocybin work differently. So for the other classic psychedelics like LSD and psilocybin, so they activate the serotonin receptor, but they don't block the reuptake like MDMA does. So they do cause this surge of serotonin into the receptors, but that serotonin can still come back in the cell. And so that's why you actually don't have a hangover after a psilocybin experience or an LSD experience. You may be tired because you stayed up all evening because your sleep is disruptive, but it's not in the same way that it causes you to be very blue. So that serotonin basically gets recycled. And how antidepressants work. And so most antidepressants fall into a category of drugs called selective serotonin reuptake inhibitors. As that name describes, they are inhibiting the reuptake of serotonin. So they act a little bit more like MDMA, let's say. And they don't cause a surge of serotonin into the receptors the way that MDMA does, but they block the reuptake of serotonin. So it keeps that serotonin circulating in between the neurons for longer. And that elevates your mood and is able to produce those antidepressant effects. And so, yeah, the three work quite differently, even though they're all acting basically on the same receptor, which is very interesting. And I think another reason why when you have antidepressants, there's this buildup time. I think when people are prescribed them, they're like, okay, take it every day, but you may not see the effects for 2 weeks or 3 weeks. And that's because it's building this serotonin reuptake inhibition to keep the serotonin floating around. And then when you come off antidepressants, it also takes some time because you have to wean yourself off, because otherwise your serotonin doesn't know where to go because it was floating around there before.
And what's the difference between using MDMA and then using psilocybin, for example? They have different experiences, right? And then how can you talk a little bit about that difference? Maybe both from like chemical perspective, but also experiential perspective.
Yeah, so they definitely are two different molecules, and they do produce different effects, even though they're working on the same receptor. And typically with psilocybin, people will report open eye visuals, as well as elevated mood, maybe more introspection. And honestly, a lot of work has gone into understanding this open eye visual experience, but we really don't understand it clearly of how that's happening. Of course, they think, oh, there must be something going on with the eye. Like this receptor must be influencing something that's happening with your vision. But really, it's more of a perception influence. And so we think because of different regions of the brain where serotonin receptors may be more concentrated, that this is in a visual cortex and that's how it's having that effect. But honestly, we really don't understand it that much. And then MDMA, on the other hand, you may have some intense visuals, but this is a little bit linked with your pupils dilate on MDMA. So you're letting a lot more light in, which makes very intense light experiences very exciting. But also just simply because you're letting more light in than your eyes would want to do if you were not forcing them to be dilated. And so, yeah, it's still like an area of research. We really don't understand what happens and why we have these really intense open eye visuals. So really it's something happening in our brain that sometimes really feels a little bit more like a dream sometimes.
So that's fascinating, because when you were talking about how psychedelics bind the serotonin receptors in the brain, in my head, serotonin is always just associated with feeling good. And obviously with psilocybin, it's always described as a much more profound and deep and introspective change of perception experience. So it's fascinating. How does that actually work? What does actually happen in the brain to create that sort of experience? And what you're saying is that basically we don't know exactly. We know that it binds the serotonin receptor, but we don't know what else it does to create that kind of effect.
Yeah, exactly. Even though the classic psychedelics are most well known for their binding to the serotonin receptor, there actually has been studies done that identify that they bind to 14 other receptors in the brain. And we just don't study those as much because we know the most about the serotonin receptor. And the way that molecules bind to receptors, they can bind fully, they can bind partially, they can bind for a short period of time or bind for a long period of time. There may be interactions with these other receptors in the brain. Even also the dopamine receptor gets activated by these drugs as well, that we don't know exactly how they interact. Like maybe they are just a partial activator or a partial inhibitor. And so there's a lot more going on. And I think we're surprised all the time with what we find. And it's exciting to see that as these clinical trials basically get completed and that we have more research being funded, we'll actually be able to understand a lot more about these drugs and how they affect so many different types of things in our body and our mood and our cognition and our perception and all of this.
Yeah, which I guess also then gets into this conversation that traditional perception of psychedelic therapies is that it's purely for, mental health, depression, PTSD. But it seems like the more we understand and will understand about them, the scope of the application could be widening, right? And we could start exploring different use cases like chronic pain, chronic trauma, etc.
Yeah, exactly. I think there's a bit of a commercial influence here too, because the academic institutes doing work with psychedelics, but there's also a lot of commercial industry looking into psychedelics as well. And last year I put together a database and I found like 50 companies working on psychedelics. I'm sure that list has grown since the last time I did a proper dive. And this is startups. This is like larger companies like Compass Pathways or Atai. And because of the path that these drugs have to take to market, where they follow this clinical trial, you have to do phase 1, phase 2, phase 3 clinical trials. It's very expensive. It's much more of a traditional pharma business model, which we know drugs can sometimes cost $1 billion to get to market. So if you're doing a similar path, but a little bit less expensive because we know what these drugs are, they still need that patent protection that like a novel pharmaceutical drug would have. So they want that 20 years of protection. So there's a lot of novel formulations that are coming up. So we have a ketamine nasal spray, for example, or we have different startups looking at patches, or maybe something that could just dissolve on your tongue, or a fast-acting psychedelic, or a slower-acting psychedelic. So there's a lot of innovation happening with these basic molecules so they can get that patent protection. And that's opening up a whole interesting industry around the kind of the psychedelic studies. And so with that, they're also looking for use cases as well. What would be the interesting use case for this new formulation? And maybe that goes beyond mental health. And that can be looking into eating disorders. There's some cool work being done for women's health around anorexia and psychedelics, and looking at different types of depression, not just treatment-resistant depression, but maybe postpartum depression. And looking at even, I think I was like, I'm trying to think of other examples that I saw recently, but I would say a lot of the industry is just throwing psychedelics, any mental health condition, or any type of something that you could tie it together and seeing if it works, which I don't think is a bad approach. Mental health has been significantly underfunded for a very long time, was not taken seriously. And so it's good to see that even if we don't find that the psychedelic is the key contributor to improving mental health, that maybe it's just a structured assisted therapy program.
And what's your take on microdosing versus macrodosing? Microdosing seems to be trending right now. People are doing it to increase their creativity and productivity, and they're sharing their protocols on the internet. But yeah, what's the difference between macro and microdosing? Do we have evidence for both, or is only macrodosing really being studied and researched?
Yeah, both definitely have a place, and studies are being done on both. So going really with that formulation aspect is that there's a lot of doses that are being tried for different use cases. And when I read a lot of studies, like I actually think a majority of them are microdoses, to be honest. So it depends on the drug, but maybe for psilocybin, like a microdose would be like 10 milligrams, while a heroic dose is 3 grams. So it's like significantly more. It's I know, or even some 5 grams. Like it's really like this is 1,000 times more. I mean, yeah. And so 10 really going to do anything? And so I think this opens a question. It's a big area for study is if you're having these psychedelic interventions that's so small, maybe they do have impact. And then you don't have to do a very hallucinogenic experience to have that benefit. There's also an area of development too, where scientists want to decouple that hallucinogenic experience from the psychedelic experience. So you can still have maybe some of this introspection, clarity and thinking, overcoming some events in your past, but without the open eye visuals and all of that people are quite afraid of experiencing. So if you're able to decouple those and feel you're able to process this, but it feels like taking a ibuprofen instead of taking a mushroom dose, like that could be quite interesting. But then there's a camp of thought of if you decouple those things, is it really even a true psychedelic experience? So there's some purists there that think, oh, they have to go hand in hand. But yeah, but back to micro and macro dosing, I think it's really complicated because I think it's interesting if you're able to have a treatment plan that's very effective at a microdose, and then maybe it is more of the assisted therapy that's doing the work. But maybe the psychedelic is opening a door to accepting that help and that process versus doing something that is quite intense and is, I think as some people say, it's like doing 10 years of therapy in 2 hours and can be very hard then to integrate because of the intensity of the experience. So I think both have their place and both can work, and we're all different individuals. So I think it's good that we're exploring kind of both. And then the last point about is microdosing this on the streets trend. I think it is. And there's quite a bit of work looking at, is it even effective at all? Is it even doing anything? And because it's not in an assisted therapy setting, it's like people are like, oh, I'm going to try microdosing to boost my creativity for the next 6 weeks. And I think people often report quite positively about their microdosing experience on an individual level. And again, I think there's a place for it as long as I think there's some intention behind it. And it's not being taken like haphazardly or maybe without some structure. I think it's good to really think about it and what you were trying to get out of that experience.
Yeah, that makes sense. Okay. So now, topic that I really want to talk to you about, which is psychedelics and women's health. Last year in August, you wrote an awesome newsletter about psychedelics and what sort of impact they could potentially have on women's health. I loved it. It's largely why I reached out to have you here on the podcast. And I'll put the link in the show notes so people can check it out. But I want to discuss it with you a little bit. And maybe let's start by you talking about how could psychedelics impact women's hormones or women's differently in general?
So yeah, the inspiration of this article was honestly just the lack of research done in this space. And we know that we have just a lack of research in women's health in general, but also particularly in psychedelics. And also a lot of studies are just not looked at really for gender differences either. So even if the study was done with both men and women, that's not considered a factor in the study. And which is quite surprising because we are very different and there's an opportunity there to look at gender differences. And so, yeah, psychedelics are really interesting for women's health because there is this idea around that if psychedelics are very good for mental health, that there could be a gateway in to treating specific kind of women's depression and trauma and struggles maybe with motherhood and pregnancy. And maybe there are women's health issues that are rooted in some of that trauma. And there's an interesting study that I'm actually not sure if they did if they were able to get the clinical trial funded, but it was around endometriosis and chronic pelvic pain, which are two issues that affect a significant amount of women. I think endometriosis affects about 10% of women globally. And it causes severe pain during menstruation and is often just completely ignored by a doctor. There's not very good diagnostics around this. And people think, oh, you just have a particularly painful period. And there has been a link of trauma associated with chronic pelvic pain and perhaps even with endometriosis. And so if we're able to use psychedelics to process some of that trauma that maybe came from an abusive relationship or some type of physical, sexual abuse that happened to that woman, which also physical and sexual abuse happens to basically 1 in 4 women. So this is not uncommon. And that can stay with you mentally and make things quite scary to have future sexual experiences. So if you're able to unlock that door into that trauma, process some of that, then maybe you'd be able to relieve some of these endometriosis and chronic pelvic pain symptoms. So it's very interesting, but also very, again, under-researched.
Yeah, that's absolutely fascinating. And in your newsletter, you mentioned, I think, a very interesting study that involved 60,000 premenopausal women, I think, with endometriosis. Can you talk a little bit about that study and what were the outcomes of it?
Yeah. So in that study in particular, so for 70,000 premenopausal women, they had abusive past, so either a sexual or physical abuse in their childhood or adolescence. And these actually had an increased risk of endometriosis. So there is like some link there between development of endometriosis or maybe inflammation that is happening because of that stress and that trauma. And so to see that link, that really even gives a case too, where it would be very interesting to see if we can relieve that by dealing with that trauma that's associated with that sexual and physical abuse. And another thing is, like, a lot of women don't talk about these experiences because people don't take them seriously, or they're afraid to come forward, or they feel unsafe going forward because they're maybe still in that situation. And so even having an opportunity where they can deal with this may not actually be an option for them in their current situation. And so could be an opportunity for a psychedelic intervention. But I don't know if I can't remember if the group that was looking to get this funded, the study funded, was able to get this going yet. I'll have to double check for that, and then I can send you the link for you to add it to the show notes.
Thank you. Yeah, absolutely. So there seems to be this bigger thesis around psychedelics and women's health. In general, this idea of mind-body connection is no longer controversial to bring up. And this idea that trauma can have an impact physiologically and can manifest in disease or chronic pain. So if using psychedelics, we could effectively treat the kind of trauma response that we're having throughout life, that it could possibly also have an effect on like how that trauma manifests in our body via, for example, chronic pain or PCOS or whatever that may be. I mean, that could be a huge unlock for women's health, right? I mean, I know we need more data and we need more research, but it seems like there could be something there. So on that note, can we also talk about hormones, which obviously are a big part of that picture? Can you talk about how psychedelics impact women's hormones in particular? I thought it was super interesting what you wrote specifically around estrogen interacting with serotonin and how psychedelics could come into play there. Can you talk about that, please?
Yeah. So estrogen is super interesting because estrogen also interacts with the serotonin receptor. And this was something that I didn't know at all. And estrogen actually can increase the density of serotonin binding sites in the brain. And this can influence mood and mental health and behavior, emotion, and everything in between. So there's this really intense link between the major female hormone and our major happiness receptor, which is so fascinating. And so then, circling back into trauma, it's then, okay, if in trauma we're unable to maybe just dive into that because of your serotonin isn't working properly because of that, because of the mental health, it could really be tied all together. And so I find this whole thing super fascinating, but it is also still a black box. We don't totally understand it. We don't know how estrogen works in relation to the serotonin receptor very deeply. Again, a very big opportunity for more research studies to happen. And then, of course, we have during menopause where we significantly drop our estrogen levels. And then thinking about how that affects our mental health. There's a lot of depression associated with perimenopause and menopause, which could be a direct effect of estrogen not interacting with the serotonin receptor. I also recently did a newsletter on hormone replacement therapy. And this is something that's been quite controversial, but now has been really debunked, that women shouldn't take hormone replacement therapy during this period. But if we can alleviate a lot of these symptoms, like of depression and hot flashes, weight gain, all of this, by continuing to add more estrogen, which then maybe be activating the serotonin receptor, this could be very significant in alleviating menopausal depression. And I think also we could go into post-pregnancy, postpartum. Yeah, and then also with postpartum depression, because I think also your hormones have been significantly changed when you're pregnant with a child, and then you give birth to that child and your hormones are trying to readjust. And this also might be because your estrogen is at a different level, and this could be then not activating the serotonin receptor the same way. So it's really quite fascinating, the whole thing. And yeah, it's this brain-body connection. It's not separate. We've been treating it separately for decades in medicine, and it is time to look at these things in a more connected way.
Fascinating. I mean, this whole connection between estrogen, serotonin, and psychedelics is really interesting. Like, what about menopause, for example? I know this is wild and probably completely unresearched, but surely that's an interesting area of research as well. Like, if there could be longevity benefits, because of course, with the onset of menopause, there's, other health risks that come up around bone health, brain health, heart health, etc. So I don't know, could psychedelics have a longevity benefit if they're incorporated during menopause, for example?
Yeah, it would definitely be an interesting place to research around menopause, and if psychedelic interventions could change that experience for women, because estrogen has a lot of other purposes, not just activating the serotonin receptor, of course. So a psychedelic experience wouldn't totally replace the lack of that hormone being there, but maybe a depleted level of estrogen plus a psychedelic together could be a big contributor into I think improving mental health around the experience, because also it is a time in a woman's life that's very changing. We as women have these kind of chapters of our life where we have before your first period, then you have this fertile window of time, and then you have the menopause experience, which can be up to a decade long, and then you have post-menopause. And our bodies change significantly in all of those chapters. I think easing the transition into these things could be an interesting point of research. But yeah, as you mentioned, it's just there is so much that could be looked at here. So we just need more funding into women's health across the board, not just into psychedelics research, but also into just women's health in general.
Right. And so what do we know? Are there areas of women's health that psychedelic therapy is being studied in? And are we seeing any positive results anywhere?
Yeah, so I did mention before about eating disorders. Some psychedelics have been looked at for eating disorders, and they've reported some positive results. There's also quite a bit of anecdotal information of people that have suffered with anorexia or bulimia that then tried psychedelics and opened their eyes to not looking at their body in such a dysmorphia, and then they were able to overcome that fear or that insecurity. And there also have been some actual clinical studies done as well, looking at, I think also binge eating and anorexia and bulimia. And the results are positive. But I can't tell you the exact kind of percentage of improvement, but just that overall, the theme was, I feel very differently about my eating disorder. And that's also the problem. It's a challenge with mental health studies is because it's really done through surveys. So it's before the intervention and then surveyed after the intervention. And there are these official scales of severity of the disorder. And then you decrease your score after the intervention. So that's really the way we're measuring it. So it would be wonderful also to have diagnostics that could really say, yes, this actually is significantly decreased or is no longer there.
Yeah, I can definitely see that challenge of objectively measuring how someone feels and whether your condition has been improving over time. What you're saying is really interesting, like the effect of psychedelics on eating disorders, because it just sounds like very different to just a chemical shift, and making you less depressed or more happy, whatever. It sounds like it's more a perception change. It's a perception of your body and the shame associated with it. And yeah, it's the fact that psychedelics are able to change that, of course, with therapy, but still that they're able to change that. That's really interesting. What other women's health areas are being researched and are showing interesting results?
Yeah, so also in postpartum depression, and this is something that I think, once again, is not quite well understood. This type postpartum depression affects around 10% of mothers and in high-income countries and a larger percentage in kind of middle-income countries. And it's believed that women just are supposed to push through it. Maybe they get prescribed a selective serotonin reuptake inhibitor, but it is for a shorter period of time. So I think this is an interesting one to study because it could be something that's quite beneficial with a single dose intervention with a psychedelic. It's also it's a big change as well in a woman's life that you were an individual and now you have another human in your life that was inside of you and now it is not inside of you. And that connection with the baby really changes. And so I think it is also something that's quite interesting for a psychedelic therapy. But a lot of these studies are also they're ongoing, they're incomplete. We don't have a lot of data around a lot of these things. So psychedelics are being tossed at a lot of these different areas, but we don't have I would say, really clear paths forward for bringing these to the clinic. It's some small study was done as a proof of concept to be able to do a larger one. But yeah, so I think postpartum depression is a really interesting one. I know there was a study done with ketamine, because postpartum depression affects women more when they have a C-section. And a lot of babies in certain regions are delivered primarily by C-section. I know in South America, this is the preferred way of birth. And I think in the United States, this is maybe even 50% of babies are being born, even higher. Yeah. And so if this is something that's very much tied to the C-section itself, then maybe there could be an intervention done after the birth or quite quickly while you're still even in the hospital. And so there was a study done, I think, with C-section, with ketamine. It is since it is FDA approved, and basically right when the umbilical cord was no longer connected to the baby, they could infuse the mother directly with ketamine. And there was a positive experience after this that they felt, compared to the control group, that they felt less postpartum depression than the women that didn't receive the ketamine intervention. Very also creative ways to administer these drugs that's even becomes part of the birth plan, potentially, which is quite mind-blowing in itself.
Yeah, that's absolutely wild. Really interesting. I also remember I read in your newsletter about this thing called moms who mushroom. Can you talk about that?
So there's this rising trend right now for psychedelic use in motherhood, because motherhood is a complex experience, especially I think the internal struggle with the societal expectations of motherhood, your own judgment of yourself into that, what society expects you to be, this perfect mom. And if you're a working mom and that you're not as good as a stay-at-home mom. And if you're a stay-at-home mom, you're not giving your child enough inspiration because you're not working, and you're just expected to do it all. And women are expected to take on so much. And that whole experience is incredibly stressful and causes a lot of anxiety. So microdosing psychedelics has been rising in popularity as an alternative to the standard serotonin reuptake inhibitor, because typically stressed out moms go to their doctor and they're going to be prescribed an antidepressant. But instead, moms are trying to perhaps just use a small amount of psilocybin, so a non-hallucinogenic dose, and that just brings a wave of calm, is able to help them just share with each other more about the struggles, creates a community around the experience. And I really see a lot of benefit there. And I think it's quite positive because otherwise moms will self-medicate. They'll have a glass of wine at the end of the day. And I think there's memes on the internet about mom needs a glass of wine or 2 or 3. And alcohol is a drug. We forget that a lot. And it's a depressant. So actually you feel good in that moment, but overall you're actually creating more of a depressive effect on your body. And we know how alcohol makes us act. You have 3 glasses of wine and that's quite a bit of wine. I think when you compare the two, okay, if mom's going to have 3 glasses of wine at the end of the day and be around her kids, but we think that's okay, versus going on and having a microdose of psilocybin, or what's very popular is having a cannabis gummy at the end of the day. And then maybe you're in a bit more of a playful state, actually, and you're feeling a little bit more creative. Maybe you do want to play with your kids in their imaginary world for an hour in that state of mind. And I think maybe that actually would have a positive effect on your children, as opposed to maybe 3 glasses of wine. Mom doesn't want to get off the couch. We're watching the show. I think there's a lot of end behavior that can be impacted by like the choice that's made there. And then of course, also, if you're not taking any serotonin reuptake inhibitor, you're not on antidepressants, that's feeling pretty good for yourself and your body, that you're like, oh, I was just stressed out like a couple times this month, or maybe just a couple days this week. And this was what I did instead of having to be on something all the time.
So are there really no organizations, institutions, research centers who are actually actively focusing on psychedelic therapy and women's health? Like no one at all is doing this. There's no one that is actively researching this topic right now.
No, I hope that somebody that listens to this podcast can correct me and put something in the comments, because I don't know groups that are focusing specifically on women. Even if there are interventions specifically for women, they still will test them in a clinical study that includes men. And in some cases, they'll still prefer to do the initial phase 1 in a group of men sometimes. And it really is quite shocking. So I would say there's very little being done very specifically for women.
I mean, clearly after everything that we've discussed, there's just so many areas in women's health that would be fascinating for psychedelic research and for psychedelic therapy to just come in and be tested and make an impact. Just seems like a no-brainer to me. So if you're listening to this and you're considering this kind of research, Nina and I are available. Give us a call.
Exactly.
So I know we both are quite optimistic about psychedelics and the research and everything that's happening in the space. But just to take another perspective on this, is there anything that you would caution people about out there, especially maybe in geographies where psychedelics are recreationally legal to play around with? Are there any words of wisdom and caution that you would like to say just to make sure that we're kind of covering all the bases here?
Yes, absolutely. That's a very good point. I think there is a belief generally in pharmaceuticals that we're going to find this magic bullet. We're going to find this one drug that's going to fix everything. And that's really a very rare occurrence that something like that's going to happen, especially in things with mental health. And so with psychedelics, it's not that like that magic pill. And when you want to have a psychedelic experience, I think it's also very important. We talk a lot about set and setting is the term, that you're in a comfortable place, you're around people that you trust, and whether that's a ketamine clinic and you trust the psychiatrist that's going to take you through that journey, or if you are trying to experiment more recreationally, that you are with a group of friends that you trust in a place where you feel safe. Those two things, if you can get those right, then I believe that you'll have a much more positive experience than if perhaps you are at a music festival and you lose your friend group or something like this, where it can be quite stressful because you're in not a foreign place, but an unknown space around a lot of people, and having maybe open eye visuals that can be very intense and disorienting. And so definitely thinking about the set and setting, thinking about an intention, thinking about if you do want to experiment with these drugs, going to a reputable place and a source. And if it is legal in your region, that knowing, why I would trust your dealer, more or less. Because I even think that phrase, innately, there is distrust there. It's much better now with cannabis because I was living in San Francisco before. We were one of the first states to legalize, and we had the Apple store of marijuana. And it's really nice when you walk into this brightly lit, beautiful space, and then a man in a lab coat is like, how would you like to feel? And shows you like a chart. I feel much more safe with the product in that setting than if you're acquiring this through more black market routes. That can be very distrusting. You don't really know what you're getting. And also then on that note, there are a lot of drug testing kits available. I highly recommend if anyone's going to experiment with something recreationally to purchase one of these, take it seriously, test your product. There's a rise of fentanyl contamination and like ecstasy, cocaine, ketamine, and this has been a significant killer in different regions. Make sure that you buy a test kit, test what you have.
Are there any specific preconditions that people should really know about, like from mental health perspective, that maybe make someone a less good candidate for taking psychedelics?
Absolutely. Thank you for bringing that up. Yes. So if somebody is on selective serotonin reuptake inhibitors, this is not you should not be taking psychedelics if you're on SSRIs, especially something like MDMA that floods your brain with serotonin and you have your serotonin receptors inhibited through your SSRI. This can be quite fatal. That is super important to know and to take very seriously. If you are one of those people and you are thinking about experimenting with psychedelics, it is very important to consult with a healthcare professional.
Yeah, absolutely. Just important to say that obviously nothing that we've discussed in this episode is medical advice. It's all just very curiosity tickling. So if you're out there trying psychedelics yourself, be extremely careful. So fascinating. I've learned so much about psychedelics and psychedelic therapy and psychedelics specifically for women's health. Just makes me want to do more research and talk to more people and pull more people into the space and bring more action in psychedelics towards women's health.
We are 50% of the population, not a small market by any means.
Absolutely. And one of the founders that we met a long time ago at Femtech Lab said something that stuck with me forever, which is, yes, women are 50% of the population, even a little bit more, but 100% of the population needs to be born. So women's health is everyone's health at the end of the day. I also wanted to ask you, what are you researching right now? Is there anything new that you're currently obsessed with that's on your radar?
So I am such a curious person that I have a running list of things that I want to research that is now, I think there are like 95 items in the list in my Notion table of like potential topics for the newsletter. Obviously, with my new job, I'm super interested with like neuroscience and diving into like perception, behavior, different types of interventions that we can use to target this. I think this is super fascinating. Going into longevity next week, the article will be about longevity supplements, popular longevity supplements, and how can we outsmart aging? And the list just goes on because it's really around a lot of health, a lot of health and neuroscience, and how those two things intersect is really fascinating to me right now.
Cool. Yeah, I'm looking forward to that newsletter, 100%. Great. One more question before we wrap up. What do you think the future of medicine will be about?
Oh, I love this question because I wrote about it. Okay. There's an article. It's called Med3. I can't remember how long ago it came out, but I had recently read Peter Attia's book, Outlive. And in his book, he talks about the future of medicine and the evolution of medicine. And he thinks we're in this Med 3, or we're approaching this, what he calls Medicine 3.0. And originally, Med 1 was just, say, like acknowledging that health is a thing. Very basic interventions. And this really changed with Medicine 2.0, which was the discovery that diseases are caused by bacteria, or like acute infections are caused by bacteria. And then the invention of antibiotics to follow that. So we're experts, acute health issues. We can cure an infection, we can reset a broken bone, but we're very bad at prevention. And so Peter Attia thinks that the future is in this medicine 3.0, that we're going to be focusing more on prevention, because now that we're good at treating the short-term stuff that used to kill us, now we're living a bit longer and we're getting all of this chronic disease that we don't understand whatsoever. And that is going to take a whole new set of interventions, because we can basically keep somebody where they're at in a chronic disease and not progress further, but we're not very good at reversing it or treating or preventing it at all. The future in this kind of new section of medicine, probably the next 50 years, let's say, where we start to really adopt prevention interventions. And then a subtext of all of medicine, or maybe it was like a buzzword for the last decade, is all around this personalized medicine, that we're going to be able to have very targeted therapies for each of us as individuals. And the way I see it is that is like Med 4 to me, because we are still on a very long path to totally personalized and individualized experience. We are still treated, if you have a disease, you're treated like all the other people that have that disease. And maybe if it is a cancer therapy, you'll have a slightly different chemotherapy than somebody else. But I would say it is not personalized in the definition that we really want it to be. I think we need to tackle this prevention piece in our lifetime. And hopefully by the time that we're in, our 100-year-old years, we'll start to really see that personalization element come into play, because there's so much potential there. And I think it is like a long horizon moonshot goal that we're going to be able to replicate our own organs, or we won't need a blood transfusion from somebody else, because we are able to make our own blood via some pathway that hasn't been invented yet. And that, I think, is really truly personalized medicine. So that's where I see the future of medicine, that first we really need to tackle this chronic disease problem in a way that we need to learn how to treat it better, and we need to learn how to prevent it and manage it. This is the next phase.
Thank you for that. I'm so glad I asked you that question. And I will definitely include that newsletter that you mentioned in the show notes as well, where you discussed that. I think that's a wrap. Nina, thank you so much. This has been super interesting. And just thank you for everything you do. I think you truly add so much value in the work that you're doing with Nina's notes. It's super interesting, really engaging, and you're really driving the conversation forward by pulling all the different research and ideas together in one place and connecting the dots for many of us, including myself. Thank you for that. And thank you for today and for coming to the podcast and being just an awesome guest.
Thank you so much, Karina. It was really a fun conversation. Thanks so much for having me. And thank you for being a reader of the newsletter. I appreciate it.
If you enjoyed this conversation with Nina, you definitely will enjoy her newsletter called Nina's Notes, where she covers very sciencey topics like longevity, psychedelics, space travel, future of medicine, in a very light, digestible, non-technical way. I personally really enjoy it, and it has become one of my newsletter staples that I take in every Wednesday when it comes out with a cup of coffee. I'll put all the links in the show notes. Check it out. If you enjoyed this episode, subscribe to Mother Podcast wherever you listen to podcasts. If you're into psychedelics and the interplay between psychedelics and women's health, you're likely going to enjoy some of the other topics that I cover in the show. I'll be putting out new episodes every week, so check it out.